Australia is on high alert. We haven't seen the numbers out of Victoria today. Premier Dan Andrews will be standing up later this afternoon, but there are more than 6,000 active cases in Victoria. We're extraordinarily concerned about the Victorian outbreak and the potential for seeding in other jurisdictions, New South Wales, Queensland, the Northern Territory, and of course here in South Australia. We will continue to act swiftly, to trust the experts and keep ahead of the game. And that's what we've done in South Australia since day one. We're very proud in South Australia to have a wonderful partnership with the people of our state who have acted together to keep our state safe. And I thank the people of South Australia for that. In a few moments, Professor Nicola Spurrier will be providing an update. We have 2 new cases to report today, and Professor Spurrier will be going through the details of those 2 cases. As I said, we are concerned about seeding, we are concerned about community transmission, and we are absolutely focused 100% on keeping ahead of the game. That's what we've done in South Australia since day one. We've stayed ahead of the game in terms of our testing regime, in terms of our quarantine regime, in terms of our borders in South Australia, in terms of our education in South Australia, and that's precisely what we'll do. We still have the highest level compliance of any jurisdiction in the country, and I thank the people of South Australia for that. And today I will be announcing some further restrictions in South Australia, and we expect a very high level of compliance with these new restrictions. As of midnight tomorrow night, we will be reducing the number of people who can be at home gatherings from 50 down to 10. In addition to that, as of midnight tomorrow night, we will be moving to restrict the consumption in licensed premises from the current regime to only have seated consumption. Whether that be with food or without food, seated consumption is the only model available going forward. I also need to make it very clear that because we are on high alert here in Australia and high alert here in South Australia, are looking very closely at the moment at the density arrangements for our licensed venues. We don't have anything to announce today, but we are going to be looking at this very carefully. We're also going to be looking very carefully at the numbers who attend our football matches in South Australia, and finally fitness studios. It is very important that we act swiftly, we listen to the expert advice, and that we stay in front of the game here in South Australia. Every single thing that we do is done to keep the people of South Australia safe during this coronavirus pandemic. Our biggest, I suppose, concern at the moment is with regards to community transmission. We've seen this in other jurisdictions in Australia. It's been absent for South Australia for a long period of time, and we don't want it to come here. We also need to make it very clear that we do not want to see the types of lockdowns that are occurring now in Victoria returning to South Australia. This would be absolutely devastating to every business, absolutely devastating to every single person's quality of life. So we're going to do everything we can to stay in front of the game, and we're sending a strong message today that by working together we can keep South Australia absolutely safe. I'm now going to pass over to Professor Nicola Spurrier to provide the daily update.
Thank you, Premier. So my team had a very busy weekend, unfortunately, and we do have 2 new cases for South Australia. So that brings a total of 8 active cases for our state and a total of 455 cases. So I'll give you a little bit of detail about these 2 cases. So the first is a male in his 50s. He is known to be a close contact of one of our previous cases. It was the woman in her 20s who was announced yesterday. And so we are now testing close contacts of all cases as soon as they're identified. And that means that we're picking up some of those positives in those close contacts even more quickly. Now, this man had been advised by CDCB to quarantine, which is great, and he had his test done on Saturday, and then we got the result back late yesterday. This person does have some respiratory symptoms but is generally pretty well, but to be absolutely on the safe side, he has been isolated in a Medi hotel. And that particular person has one close contact who will be tested and then isolated, well, obviously isolated, but is also being tested. Now, that particular group of cases, which had the origins from Victoria, but we've now seen a number of people now positive, we will be calling that a cluster. The other case is of perhaps not such a concern to me, is a male, again in his 50s, who is in one of our quarantine hotels and was on one of the repatriation flights. So that was the repatriation flight from New Delhi that came in on Saturday the 1st of August. He was tested on the same day. Again, our nursing staff have been very busy over the weekend with lots of testing, and SA Pathology have done a quick turnaround time, and we had that positive late yesterday afternoon. He does have some respiratory symptoms. He was travelling by himself, which is great, and he's quarantining by himself in the Medi hotel. So we don't expect to have any more cases from that particular case. So this is obviously quite disappointing for South Australians, starting to have this number go up. We had one case every couple of days, but we are now seeing a few more cases, and this absolutely reflects the situation in Victoria. We have extremely tight border restrictions, particularly those that came in on Tuesday last week, but this is a reflection of how transmissible this virus is and how quickly it is spread. So over the weekend, I spoke to our team, and not only were they contacting close contacts, but they were also contacting close contacts of those contacts. And the reason for that is to try and put as much protection around those cases as we possibly can to protect the South Australian public. And it's also included, obviously, testing all of those people that are in quarantine because they're deemed close contacts. People will also be aware that we needed to make some school closures because one of our cases had attended 2 educational facilities. We reviewed that yesterday afternoon, and I spoke at previous press conference about one of those educational facilities. But again, I sat down with the team, and being highly precautionary, we decided to call the potential transmission period for that particular case, not just the 2 days before symptoms, but 3 days before symptoms. And that was the reason for including that second educational facility. So again, not a high risk of transmission, very, very small risk, but it's an indication that I am being extremely cautious at the moment in terms of making sure that we are stopping any transmission at the moment in our state. So deep cleaning is currently underway, as I understand, from the Education Department. We've already been able to contact all of those close contacts in the school community, and they will be tested. But in addition, we are likely to have a pop-up facility to do additional testing at the school once the school's open, and that's likely to be tomorrow for both of those. So, of course, if you happen to be part of that school community but not considered a close contact and you're worried, I do urge you to go and get tested, particularly if you have any respiratory symptoms at all. In total, we now have 95 close contacts being monitored by my team in CDCB on a daily basis in terms of symptoms. So whilst we do have an initial test done on all of those close contacts, and even if it is negative, we will be following those people carefully for those 14 days to make sure if they do develop any symptoms, they get tested again. But they are all in quarantine. Now, I know that many people have been out on the weekend to get tested. And we are certainly finding our numbers of tests going up, and I am aware that our metropolitan clinics are experiencing a very high demand today. Flinders Medical Centre in particular have said they are temporarily not accepting any more people because they want to get through all of the people that are waiting there. But we're updating that information on our website. So if you do need to get a test done today, please don't despair. Have a look at our website and see what alternatives you can do. Certainly the drive-through are very quick, but you will need to get your GP to send through a referral form. But just phoning your GP is usually the way of solving that problem. Now, just in terms of something else that my team are working through, we do have a couple more repatriation flights coming to South Australia, and I was asked about those details yesterday, and I can fill people in. There's an Air India flight expected tomorrow with 149 people on board. And we also have a scheduled Singapore Airlines, which is a commercial flight expected tomorrow with 123 people on board. So there are chartered repatriation flights, but we are starting to see some commercial flights coming into South Australia. Again, it is bringing people who are Australian citizens or permanent residents back into our state. But importantly, with the commercial flights are also bringing freight and supplies that our state needs. And of course, that means that when they fly out of South Australia, they're taking commodities that people in South Australia are selling and wanting to take to the international market. So I think that's also important to take into consideration. So I think that's the end of my update, and I'm happy to take a few questions, but unfortunately I do need to zip off fairly quickly to a meeting.
Is the man in his 50s linked to yesterday's case a student at that school or not?
No, it's not. No.
So is it someone that's been living with this woman at home?
No, it's not somebody that's involved in the home setting, and I really can't give any further information about that.
The 95 close contacts, they're close contacts of the woman in her 20s, are they?
No, that's in total. So we've had 9 cases in South Australia in the last 10 days. So overall, we've now got 95 close contacts. So that just shows people that when you have one person that's positive, how quickly you can have a transmission to a large number of other people. So out of those 9 people, we have now 95 close contacts.
With that in mind, Professor, has time come for isolation not just to be monitored by self, but actually be sort of like a quarantine, more strictly basically enforced, supervised rather than just relying on people's goodwill?
Yeah. So the vast majority, and I think almost, I could probably say all except for one person who's a minor, are in the Medi Hotel. These are our cases for isolation, and what we are doing is looking at any of the people who are close contacts who now need to be in quarantine. We're looking at that on an individual basis. If they can't quarantine safely in their own home, we're also requiring them to, or we're assisting with them to come into hospital, into a hotel situation. I just wanted to stress the point that I made yesterday. If we make it too onerous and too difficult for people, i.e. for them to be required to go into a hotel for quarantine, one of the things that my team worry about is that people may not come forward and get tested. So I just think we do need to weigh those things up. But we look into every individual situation and make a call on that.
Have any of the cases, including the ones yesterday, any of the cases in SA been transmitted through people quarantining at home with other people?
I'll have to get that information for you. There's been a lot happening over the weekend.
So it's possible that somebody has been quarantining at home with other people and given it to a close
Yeah,
family.
I don't think we've seen that actually. But to be 100%, I'd have to go back and have a look at the data.
You able to identify which days the woman attended the 2 schools during the course of the week accurately now? You able to tell us which days she was there so people know when they were in contact with her?
All the people that happened to be there on the day she was there have been contacted directly, so they're already aware of that. From my recollection, one school was on Tuesday and I think the other school was a Thursday.
Professor, how concerned should the South Australian public be now that we've had this influx of cases? And can you also explain how if they're in Medi Hotel quarantine, how a close contact of this mature age student was able to become infectious if they are not a relative?
So can I just get to the first question?
how worried should the South
Yeah.
Australian public
So-
be about this new influx of cases?
Yeah, I think this is really concerning because we've now seen transmission within our state to close contacts of cases. So that is very concerning. We had been seeing people who had come from Victoria who have become positive, but we're now seeing more transmission. Now, going back to the actual details, I can't give you personal information about people, but what I can say is it is extremely transmissible, this virus, and that's why it is so important for people when we interview them that they give us as much information as they can about their whereabouts. We're also, again, it's a good point to stress the COVID Safe app. I know we haven't talked about it very much, but it is so important that we have people download that because it helps us do that contact tracing.
So have you been able to use the COVID Safe app?
No, it hasn't. It hasn't helped us, but not everybody has downloaded it. So until we have, large numbers of our public population downloading it, I know that South Australians done a really good job actually downloading the COVID Safe app. But it's just a reminder today: if you haven't done it or you haven't had your Bluetooth on, it's a good day to think about doing it.
There seems to be a lot of anger over, particularly that teenage girl who had the symptoms in Melbourne. 11 days later, flew into Adelaide, bunkered down with a number of siblings, and police had to knock on her door 5 days later to get a test. We've contacted police to ask if she was fined. I know she might have been frightened, but is that good enough? Shouldn't people be doing the right thing, being let into our state?
This is a very young person. Let's make the point. She's a young person. She quarantined adequately, so we were actually quite happy with the quarantine. And also, I think the fact that we now have an ability to reconcile the data, we can catch up with people, and that's exactly what happened.
Should her parents be responsible for her if she's a minor? Someone must be responsible.
I think I'd pass those questions of enforcement over to the Police Commissioner.
Have people been doing the wrong thing though? How is it that we have 95 close contacts in such a short amount of time?
It's not about people doing the wrong thing. It's because this virus is so transmissible. It's very easy to pass it on to other people. I think people probably underestimate how easy it is to pass it on, which is exactly the reason why I keep reminding people to stay your distance, to keep washing your hands. And I know it's been easy to forget about that when we haven't had the virus in the state, but this is exactly why I wanted people to know the numbers of close contacts that we are now monitoring.
Professor, just to clarify, are you actually considering making all quarantine or all arrivals go into supervised quarantine? Is that an option at this stage?
No, it's not an option at this stage. We have only a certain number of hotels that we can use and only a certain number of the police force who we can use to supervise. So it really is not an option. There are too many people. However, what we do is on an individual basis is we make a call on who we think would be safer to be in that quarantine, that hotel quarantine. That may be because there's somebody in their home who is vulnerable, or it may be that they don't have the facilities in their home to stay away from other household members.
Sorry, one more question.
Last one further. We only have time for one more.
Just on Flinders quickly. It says on your SA Health website that the testing's closed and to please go to the respiratory clinic. But the next available appointment is Wednesday morning. Does that seem right?
We do have a large number of testing facilities across South Australia, so it might not be just around the corner from Flinders, but I do think if people have a look, there might be the timing at the Royal Adelaide, for example, might be shorter, and there's also the drive-through at the repat. Thanks.
On testing, Premier, while we're on that note, is it time to roll out more drive-through testing clinics? Do you think that's needed to try and clear the backlogs that we're clearly seeing at the major spine hospitals? Yeah,
look, I'm absolutely convinced that we have the best pathology services in the country. We've been leading, not only the country but the world, in many of our responses, pathology responses, and we're constantly looking at updating those, and I'm sure we've got more to talk about later in this week. We do have a very considerable spike in the number of tests that have been administered over the last week, and we're very, very grateful for that. You might recall, if we go back sort of 2 or 3 weeks ago, we did a press conference. We were out at the Hampstead Centre. We were back then averaging 1,500, 1,700 per day. Professor Spurrier said she didn't want 1,500 or 1,700, she didn't want 2,000, she wanted to get to 3,000. We've now surpassed 4,000 on a pretty regular basis in South Australia. We already have in excess of 60 dedicated rapid assessment and testing clinics in South Australia, including the drive-through, and now 11 mobile testing stations. And what you'll see is as the risk increases, more people are going to get tested, and we're going to have an increase in the testing availability right across the state.
Premier, can I just ask you about the consideration of new restrictions being introduced?
Yes.
Can you please explain why that is being introduced, and what particularly are you looking at in terms of the new restrictions in the coming days?
Australia is on high alert. We currently have in excess of 6,000 active cases in Victoria, and this is of great concern. We're particularly concerned about the potential for seeding that goes unknown for a period of time. Some of the people that have come across the border were not even linked to the cases that have already been identified in Victoria. So we're very, very concerned. And from day one, we've been in front of the game, not playing catch-up, but in front of the game. And we're proactively putting these new restrictions in place to avoid the type of lockdowns that we're currently seeing in Victoria. That would be absolutely devastating for our state, for our economy, for jobs, for families, for the health of the people of South Australia. Yes, we are dealing with a health crisis, but there will be a perverse health effect of the lockdowns in South Australia if they were to come back here in the magnitude that they're in Victoria at the moment. So we want to avoid that, and that's why we are acting swiftly. We're trusting the expert advice that we've received, and we're keeping in front of the game.
The limit on private gatherings, that from 50 back down to 10, that's only private gatherings in private premises.
Correct.
Not funerals or weddings, doesn't apply to those
Correct.
circumstances.
And can I just say on that, look, these are not restrictions that we put in place lightly. We hate putting these restrictions in place. We fully appreciate the massive effect that these will have on gatherings that have already been planned. Some of them planned for a long period of time, some special anniversaries or events, but we put them in place to keep the people of our state safe.
It looks like business as usual in SA at the moment, and it's been wonderful. If you go down the streets, the cafes, the restaurants are full. Do you think we've become too lax?
No, look, I think the vast majority of people in South Australia are very cooperative with the restrictions that we've put in place, but we are increasingly concerned about the level of risk coming across the border. And so we're getting in front of the game. But I've got to say, we couldn't be happier than the level of compliance that we've seen in South Australia. It compares favourably with anywhere in the country, just about anywhere in the world. And it's been a true partnership. And that's why we're being upfront and honest with the people of South Australia. We are increasingly concerned about what we're seeing over in Victoria and the potential for that seeding to come here to South Australia. We don't want it. It's going to cause enormous disruption to our state, and so we have to take this proactive stance to keep our state safe.
Just on footy numbers, what that's obviously going to be looked at next. What are you thinking? Are you thinking sort of back down to the 2,000? I mean, 25 seems pretty ambitious now.
Look, we've never been at 25. We set ourselves a goal to go up to 25, but we've never actually been at 25. What we're doing is working with the Stadium Management Authority, and we're looking at revising their COVID management plan down. It's likely to rest around 10,000 outdoor spectators plus a number of people in venues that are contained at the Oval. So I've got to say again, though, that the feedback from SA Health and Professor Nicholas Spurrier has been very, very complimentary about the Stadium Management Authority. Their ability to manage a large number of people is exceptional. And so we don't want to take that away unnecessarily, but we've got to manage the risk.